This must be a world record. The DOTR's Libreng Sakay program for medical frontliners has ferried over 2 million health workers to and from their workplaces since the community quarantine protocols or lockdowns were enforced in Metro Manila and other regions. Motoring Forum takes a look at this truly outstanding achievement. It began shortly after the government placed Metro Manila and the adjacent provinces under community and then enhanced community quarantine, ordering everybody except those in strictly defined essential services to remain at home as part of efforts to stop the spread of the coronavirus. All forms of public transportation were suspended. The enhanced community quarantine was supposed to last around 2 weeks or so. But even for that supposed short period, it became apparent that medical frontliners, the nurses and other health practitioners, and the indispensable staff at hospitals, clinics, and medical centers need help in going to and from work and home. The DOTR, working with its line agencies and in coordination with other government departments and offices, scrambled to put together what it later named the Libreng Sakay or Free Ride Service for Health Workers project. In Metro Manila, the Libreng Sakay for Frontliners program started with just 3 routes that passed through several hospitals and medical centers, with loading and drop-off points soon being aired in traditional and social media and spread by word of mouth. As the community quarantine period was extended anew, and weeks turned into months, the DOTR expanded the program with more routes and more buses participating. And the Libreng Sakay program was soon replicated in other areas and regions outside of Metro Manila, where the COVID-19 contagion spread. The Libreng Sakay program continues to this day, even as the authorities began easing restrictions and allowed more sectors of the economy to reopen. Today, the Libreng Sakay for Frontliners program now operates 20 routes in the National Capital Region, Greater Manila area. And to date, the DOTR reports that the Libreng Sakay program has recorded ferrying over 2 million frontliners since it began operating back in March. 554,625 in the Greater Manila area and over 1,446,836 outside of the National Capital Region. The continuing success of this program would not have been possible without the help of bus companies and other private transport companies and cooperatives. Included in this honors list are HM Transport, Jasper Jean, Ceres Transport and Gold Star, Filtranco, RRCG Transport, Jackliner and Dagupan Bus. Other transport companies and groups that participated in the Libreng Sakay program in various ways include the following: San Agustin, Metro Express, Precious Grace Transport, St. Rose Transit, Hafty Transport, G-Liner, Manrose, Pilipinas Auto Group, Beep, Mitsubishi Motors, Elmer Francisco Industries, Isuzu Philippines, Photon Motors, Suzuki, Meralco Isakay, Lucena Lines, Pangasinan 5-Star Bus Co. Incorporated, City Bus, Star Bus, Earth Star Express Inc., Gel Transport, at Jamliner, Diamond V8, Pascual Liner, Pamana Transport, Ube Express, DLTB, Genesis, High Star, Thelman Transit, Star 8, Mega World Corporation CityLink, Hino, Hyundai, U-Hop, and Toyota Motor Philippines likewise participated in the program. Oil companies also participated in the Libreng Sakay for Frontliners project by subsidizing the cost of fuel by participating buses. These include Petron, Phoenix Petroleum, Clean Fuel, Total Philippines, and Sea Oil Philippines. The DOTR does not want to claim full credit for the success of the projects. In almost every forum, the DOTR cites the help provided by other government agencies. These include the Office of the President, Philippine National Police, Armed Forces of the Philippines, LTO, LTFRB, MMDA, Philippine Coast Guard, and the Interagency Council for Traffic. DOTR Road Transport and Infrastructure Assistant Secretary Mark Steven Pastor said, Transportation Secretary Arthur Tugade wants the Libreng Sakay for Frontliners to continue until the COVID-19 pandemic is finally overcome. Until the COVID-19 pandemic is fully under control, the DOTR should continue this program if only to repay the sacrifices and difficulties suffered by health workers and other employees of hospitals and medical centers in the fight against the deadly coronavirus. That's our Motoring Forum this week, courtesy of Suzuki Philippines.